Hi, I'm Dr. Lennox Hoyt, Fellowship Urogynecologist and Pelvic Reconstructive Surgeon, specialist in female pelvic medicine and reconstructive surgery. I often get the question from our patients and sometimes from people when I give talks, what exactly are bladder and bowel control problems? So put it this way, a lot of women can sometimes experience problems of what's called urinary urgency. And urgency really is a sense of an urge to urinate, for example, that you can't defer. All of us get an urge to urinate at some point, but many times we're able to say, not quite right now, we're busy doing something else, give us a minute, we'll get there. And the bladder's obedient enough to follow up and allow you the space and time to do that. Real urgency has to do with the fact that you get an urge to urinate that you can't defer. Oftentimes those urges are related to things that are usually non-surgical, that are not obvious. Sometimes prolapse or abnormal bulging of the vaginal wall tissues can cause that. Sometimes prior surgery, a sling that may be too tight, for example, for incontinence can lead to that. Other times, we just don't know why. You get those urges to urinate, and those urges are usually associated with leakage. Well, the first thing to do at that point, if you came to me as such a patient, is I'd want to examine you. I'd want to listen to your history. I want to know what medications you're taking. I want to know if there's any history of, for example, radiation to the pelvis or things that could be done from the outside that could lead to cause that urgency. If we find them, there's some of them that are correctable, others that are not. Most times when you end up with pure urinary urgency and you can't find an anatomic reason, it's called something in medicine, it's called idiopathic, and what that means is we don't know why. And usually when you get to that situation in the setting of that kind of urgency without leakage, that's something that can be addressed with pelvic floor physical therapy, addressed at rehabilitating the pelvic floor muscles, which can very often help cure that particular problem. The other place that we can see a lot of urinary urgency is in postmenopausal women, because the postmenopausal state is a low estrogen state, and low estrogen levels in the vagina lead to vaginal irritation and bladder irritation, sometimes referred to in total as the genitourinary symptom of menopause, or genitourinary syndrome of menopause, GSM to be short. That's readily treated with vaginal estrogen therapy, given in a schedule that allows the vagina to rejuvenate itself or rehabilitate itself, and that can lead to cure of those bladder urgency symptoms. Another way to approach that sometimes is with medication that's designed to actually slow the bladder down. So so-called anticholinergic medicines like oxybutynin and some others like that can actually slow the bladder down enough to make it so that you don't have those urinary urgencies. The medications like those tend to have side effects: dry mouth, constipation, dry eye, and so forth. And there's also been some evidence accumulating that over the long term, multiple months usage, those medicines seem to have an association with cognitive decline in women. And so in my practice, tend to avoid the long-term use of those medications. If you have a trial of such medications and you find it's effective, then you want to look at maybe something else that you could do to duplicate the problem more locally, like Botox injection into the bladder. We caution that whenever we use medications that try to slow the bladder down, the risk is you overslow it down, and now instead of peeing too much, you can't pee at all. And that's urinary retention, and that's something you really want to be mindful of. That's why it makes sense to have a qualified physician, surgeon evaluate you before starting any of those kinds of medications or those therapies. So we talked about medications, we talked about Botox, and in really refractory cases, meaning cases that you really can't get a handle on, there's no prolapse, the estrogen levels are fine. You look at, there's no anatomic issue to sort of highlight why the situation is happening. Sometimes electrical stimulation, so long-term permanent implantable electrical stimulators can actually help. We call it a bladder pacemaker, sometimes can slow the bladder down enough and, interestingly, reduce the risk of urinary retention as well. So those can be helpful also in helping with bladder urgency and frequency. So the bladder situation with urgency, frequency means you're going to the bathroom to urinate a lot, can be helped in the ways that we just discussed. When it comes to the bowels, it's a slightly different story. There is some overlap in that long-term bowel urgency Can sometimes be related to dietary issues leading to people with celiac disease and things like that can have issues that make them have to go to the bathroom to have bowel movements quite often. And that could be a source of irritable bowel disease. Some women have alternating constipation and diarrhea that can lead to that kind of bowel urgency. Sometimes the bowel urgency is related to the fact it's a response to the constipation that can be caused when there's prolapse in the system, rectal prolapse or vaginal vault prolapse that prevents the bowel from emptying properly. In that case, the bowel fights back by trying to push the stool out, leading to bowel urgency and sometimes even bowel leakage. And those really have to be addressed episodically by thorough evaluation of medication history, illness history, surgical history, testing appropriately, evaluate for rectal prolapse or vaginal vault prolapse and so forth, and then design a treatment plan to correct the underlying problem, which then lead to solution of the larger problem of bowel urgency. So in a nutshell, bowel urgency, bladder urgency is something that you don't have to live with. And here at the Pelvic Floor Institute, we get a lot of patients that come to us with those complaints, and we've been very successful at determining the cause of those complaints and the treatment for those patients. And so if you think you have that problem going on, it's gonna be very important that you find a qualified, well-trained, usually fellowship-trained urogynecologist, colorectal specialist, or specially trained urologist to address that problem for you and determine an appropriate treatment plan for getting you cured so you can get your life back. So remember to like and subscribe and leave your comments in the bottom, and we'll try to answer as many of them as we know how. So my name is Dr. Lennox Hoyt, fellowship-trained urogynecologist and pelvic surgeon. Welcome and thank you for watching.
So when we talk about bladder or bowel control problems, we're usually referring to situations where there's stool urgency to have a bowel movement, urgency and frequency related to bladder. Many women will report symptoms where they feel like an urgency to urinate all the time associated with frequency that are not always associated with urinary incontinence. And that's a specific situation that is can be diagnosed and treated with usually non-surgical or even surgical techniques. Oftentimes, it may be a situation where the patient requires treatment with a medication to help those circumstances in the bladder space. In the bowel space, usually fecal urgency can sometimes be helped with pelvic floor physical therapy if it's appropriately diagnosed, sometimes with diet control issues, and there's certain kinds of electrical stimulation devices that can actually help with bowel control problems.